Hello everyone, I'm Rozhan Ghobadimoghaddam from the Middle East Technical University, and I'm going to talk about the very famous black widow spider. Black widows are all black with a red hourglass, just bigger than a paperclip. Only the female can bite humans, and this bite feels like nothing more than a needle prick. They are found in temperate regions all around the world. Black widows are highly venomous, and their bite is much feared because their venom is reported to be 15 times stronger than a rattlesnake's. However, fatalities from this spider's bite are fairly rare. The spiders are non-aggressive and bite only in self-defense, such as when someone accidentally sits on them. The animals most at risk from the black widow's bite are insects and male black widow spiders. So, let's start with a short story. In June 2017, the parents of the 5-year-old Kaylin Donovan noticed a bruising on their daughter's leg, which they thought was just a regular bug bite, until the mark grew and Kaylin came down with a fever. Doctors first told the parents that it appeared to be a spider bite and prescribed antibiotics. But when the girl's condition did not improve, her parents looked for answers from a pediatric infectious disease doctor. The diagnosis turned to be more like a nightmare. It was a bite from a black widow, and it turned out that the blackness on the kid's skin was not a bruise, but rather the venom of the black widow. Fortunately, little Kaylin got treated with an antivenom and several painkillers, and she recovered after a few days. So, now let's look at what actually happens in the body of people bit by the black widow like Kaylin. Within 15 minutes after the bite, localized cramps begin, and black widow venom hijacks the victim's nervous system. During the first hour, the thighs, back, and shoulders are usually the first muscles to suffer stronger spasms. The venom of the black widow spider is a combination of biologically active proteins, peptides, and proteases. The primary toxin found in the venom of the black widow is alpha-laterotoxin. It binds irreversibly to the protein receptors on presynaptic neurons and creates calcium-permeable channels within the lipid bilayers. This influx of calcium ions results in massive exocytosis of neurotransmitters, including acetylcholine, dopamine, norepinephrine, epinephrine, and glutamate. It is this release of neurotransmitters which leads to the characteristic symptoms of pain, muscle rigidity, vomiting, and sweating. During the first hour, pain becomes more severe. Black widows have a cocktail of neurotoxins that enhance the effect of its main component, alpha-laterotoxin. Together, they cause paralysis and destruction of nerve endings. During hour 3 to 12, symptoms are clammy skin, labored breathing, weak pulse, increasing pain and cramps. Morphine and other painkillers may be used to ease the increasing pain. Now, the only solution is the injection of the antivenom called antivenin latrodectus mactans. This antivenom is derived by drawing a frozen solution of specific venom neutralizing globulins obtained from the blood serum of healthy horses that are immunized against venom of black widow spiders. During hour 12 to 24, pain and symptoms begin to decrease. Most recover completely within 3 to 5 days. However, weakness and occasional spasms can happen for weeks or even months after the bite. So, that's all you need to know about the bite of the black widow. Thank you for listening to my presentation on these fascinating little spiders.